and then I'm going to share my screen. Excellent. So thank you everyone for being here today. My name is Kara Kaikini. I'm the Executive Director of the Maine State Breastfeeding Coalition. And this is one of my favorite parts of the month is having this meeting and seeing all of you and hearing about the amazing work that you're doing all throughout the month and year and learning about meeting new people as well. I think whenever I regularly hear from people who are just moving here or just joining this work and they're wanting to meet other people, and I always say, come to our Connecting the Dots meeting because we regularly have between 25 and 35 people here usually. And it's just such a great way to get to know everyone and learn about what's happening. So our agenda for today is to welcome everyone. So if you haven't already introduced yourself in the chat box, please do. So your name, your pronouns, what part of the state or country you're in, what brings you to this meeting, or what work do you do that is related to what we're talking about today. That's great. And then we'll give an update. Our MSBC update might be a few minutes longer today because Emily is going to be sharing our new strategic plan, which is very, very exciting. Some of you may have heard it at the conference, but it's always great to hear it more than once. And if this is new for you, we're excited for you to hear it for the first time. And then we'll have the rest of the meeting for you all to introduce yourselves and share any updates you have for the group. And that can be anything that's happening legislatively. I know we do have Samantha here from WIC, and I know Samantha also has to leave by 12:30, so we'll make sure that she goes first. And if there is anything else that's happening, any new research that you're hearing about, any projects you're working on, anything that where you could use some support from us, and some wisdom or yeah. So thank you for being here. You should all be able to see my screen, I believe. And this is also something that you are welcome to add to. I can get it in the chat box for you all. Right, so you are all able to add to this document. This is a shared document where you can see different things that we've added in here about what's going on around the state and the country, but you're also welcome to add things too. So know that we have a lot of committees and we're always looking for more volunteers. So if you're interested in joining and being part of any of our advocacy work, any of our events or fundraising, workplace committee, DEI committee, communications, professional development, and conference planning, if any of that sounds really interesting to you, then please reach out. You can fill out a form. And Emily, I have some links that I'll be referring to in the document. If you're able to drop those in the chat, that would be great too. So if you're interested in volunteering, our Vice President Katie, I'm not sure if she's on here yet or not, or if she's able to join today, but she will be reaching out to anyone who has expressed interest in volunteering to coordinate that. We're always looking for donations as well, and there are lots of ways you can participate in that. Right directly through our website, or you can also do, if you're on Facebook, we have Facebook fundraisers that are really easy to do. I just did one for my birthday earlier in October and raised over $400 pretty easily. Just mentioned it a couple of times, and it's an easy way for you to do that. Shauna has also had great success with that, so thank you. And again, if you want to donate your time, we have those opportunities. We want to thank our annual partners. We do receive some funding from them throughout the year, and we're really grateful for our advocate partners in particular. We want to recognize them here. So thank you to those partners. And I might go through, Emily, and come back to strategic plan. So I just wanted to remind folks that we have a webinar coming up on December 4th, and we are doing our registration through the same platform we did our conference registration. So with the webinar, we're asking for a $15 payment. If this is something you're unable to do, we do have an option to pay what you can. If you are hoping to get a continuing education unit, then we ask that you do pay that $15 to receive that. Also wanted to mention, I now have the recordings of our conference sessions, and those will be available if you missed the conference and you would like to watch a session and you'd like to get a continuing education unit for that, then we will be announcing how you can do that. We need to upload these to our YouTube page and make this available for you. We'll send you a link to the evaluation and a link to the quiz that would be necessary for you to receive your continuing education. We're also looking for speakers for our 2026 educational webinars, and you can apply. Um, this is something we'll be getting up on our website for you to check out too. But if you have been receiving our emails, then you'll see that you can click on the link to apply for that too. If it's something that the application is a bit longer because it asks questions that we need to include on our continuing education application. So if you're not sure about filling out the full application yet, and you have some questions about the process, or if it's something we think we'd be interested in, feel free to just reach out to us directly and we'll walk you through that. We have these same resources we always share every meeting, the LGBTQIA2+ reference for professionals, Zip Milk. Hopefully you have your listing on Zip Milk already. If not, you can go to the website and there's an option that says submit your listing. We have our parent resources that continue to be widely downloaded, including our Returning to Work Employee Toolkit that's available in different languages. We have our support group directory. We also recently have been sharing the list of food pantries in Maine that we encourage you to check out and share with the folks that you are working with. For donor milk, we want to say congratulations to Maine Health South Portland Pediatrics. They just opened a new milk depot and a dispensary. They're not able to be in this meeting today because they have News Center 6 there to interview them. So we're really excited that they're getting coverage. Any coverage on topics like this is really helpful for our work in general. We will have a paid leave update shortly. I believe Katie Reed is here to give us a paid leave update, but know that we have these resources in this document for you. And if you have any concerns about what is happening at the federal level with our Congress, what they're doing, what they're not doing, and how that might be impacting Maine's families, we have contact information for our senators and representatives, and we really encourage you to reach out to them. If you are, sometimes we're able to give some scripting around that, but if you are looking for that, feel free to reach out and we can support you with that. Also, the Maine Women's Lobby, Katie from the Maine Women's Lobby they're a great resource to help with that too. Let's see, moving along. We want to recognize Sue's Place Child Care Center. They are one of our Maine's lactation-friendly workplaces that we're recognizing. So congratulations to them, and know that we really are asking for folks to share our recognition program with anyone you know who owns a business or works in a workplace who might be doing basically just following the law is where we're starting, where they are providing time and space for people to be expressing milk at work. And if they're doing more than that, we do ask that they have an anti-discrimination. They have a policy that includes anti-discrimination and communication with their employees. So there are a few things that we are asking for, but we really encourage you to continue to let folks know about that. And again, if that's a topic you're interested in, we do have a workplace committee, and we will be meeting tomorrow, I believe, to review another potential application. If you ever have any job opportunities in your workplace, let us know. We can drop this in this document as well. It's hard to believe, but it is almost time for 2026 webinars and meetings. We're going to continue our same pattern of the first Thursday of every odd month meeting from 12 to 1. It'll be that same pattern, except in January and in July. In January, due to the holidays. So we will have those on the calendar soon and sent out. If you are not receiving a calendar invite and you would like to, please let me know in the chat box or send me an email. I think I need to do a little bit of readjusting on those calendar invites, but that can be a helpful thing to have. So that is it from me. Emily, would you like to share your screen, or would you like me to share my screen?
If you want to share the just the view from the website, that would be great.
Okay.
But no rush. Thank you,
And
Kara. That was awesome. So many great updates. And I'm excited to see everybody here and seeing a lot of familiar faces and names in the chat and on screen from conference and from some folks that we'll be thanking in the next section as far as participation in our strategic planning. So excited to be here. Um, Again, my name's Emily Elting, and I'm since I think it was March, have been the board president for the Maine State Breastfeeding Coalition. I'm super excited to share this with you today. This is a strategic plan that has been many months in the making. As many of you know who are involved in nonprofits like ours or like others, a strategic plan can be just a really crucial way to align on why you exist and what you really need to go after as an organization. And so we had a strategic plan in place that had gotten a little outdated. We were really excited to go into this and sort of embark on a new planning process. Um, I won't go through the whole process, but I do want to just thank again a number of you who are participated in sort of our research phase. So we really wanted to ensure that we were listening and learning and in dialogue with providers and parents and the communities around Maine, so that we were really deeply understanding, the barriers and opportunities to breastfeeding that people are experiencing right now, and some of the anticipation of the future that so many of you had great insights into. So thank you all for that. What we have here are four really exciting goals, but I also just want to start by noting that we have updated our vision and mission. So some of you might know our vision, our old vision and mission statements, and have them memorized by heart. If you don't, that's fine, because now you get to memorize some new ones. But we really wanted to have a very clear couple of statements here that give kind of people who are part of the coalition, which we consider all of you, as well as people who are learning about us for the first time, just a really clear image of why did we exist to start and why do we still exist today? And what is sort of a more inspiring kind of image of what we really want as an organization. So our mission is that why. We are all here to empower and nurture Maine families throughout their human milk feeding journeys. We got really excited about kind of the words that we were able to bring together here, and there were a lot of input and a lot of thoughts from again many of you and other folks in the community to um, help us with that. And our vision, what we see, on that sort of, if everything goes perfectly well and we're really fantastic at our goals, we would be a state where we have healthy beginnings, supported families, and thriving communities. So one of the things that I'd love to hear from folks in the chat, or when we kind of get into more around the table, is kind of, how do you feel about some of the new terminology here? It'd be great to kind of hear, does this mission feel right to you? Does the vision feel inspiring to you? Are you surprised by anything that you're sort of seeing or hearing there? So that's one thing I'd love to hear either in this meeting, or you can always feel free to email Kara or I at any time. I'm not going to go through all the details of the goals, but I think the important thing to note here about the goals and the sub goals below them are they're really lofty. We're talking about just really having a clear kind of reason for, what we need to go after to solve the big problems that we know are here in Maine. We've got the first goal really focusing on lactation support. And so we know, and we all, many of us, this is why we're here. We know that lactation support needs to be more accessible, equitably in the state of Maine. We also have a second goal here around really focusing on the broad sort of definition of providers and increasing their capacity to meet those needs. We know that a lot of people in Maine, really there and across the country, of course, their access to lactation support doesn't always look like an LC. It can look like their pediatrician, their OBGYN, the emergency medical technician that they're sort of having access to. It can be a lot of people. So we really want to cultivate relationships and build more capacity all over the provider community to meet the needs. Goal 3 is one we're super excited about, which is just this sort of image of communities of support. And I think it really connects to the words that we chose in our vision. But there's a lot of opportunity in here, and really thinking about the families who are breast and chest feeding and the support communities around them, including really building up public support for breastfeeding and chest feeding. And in order to do any of this, In order to be a coalition, you can see we've intentionally sort of built goal 4 as the foundation of everything that we do. So as a coalition, we are looking to strengthen our capacity to realize our vision. That comes in many, many forms. It looks like how we fund, the work that we do. Um, a lot of our work has to be about fundraising and diversifying our revenue. It's also about people, how we really cultivate community and relationships that allow us to, effectively achieve these goals with all of you and the networks that you represent. One thing I also want to mention is that we're working on kind of the articulation of some measurable outcomes and specific metrics that will go along with these goals. We know that's a crucial way to both help people understand and sort of articulate our goals, but also see if we're doing well. So we're really excited to kind of add that to the picture. There's a lot of work ahead for the board to kind of build in the specific strategies that we'll be focusing on for 2026. And I hope that that also kind of gives some further inspiration to Kara's call for volunteers. If these goals are inspiring to you, if you're seeing things and you're like, "Ooh, I'm doing that, I can help with that." We'd love to hear from you. We'd love to see how we can either partner with you or perhaps incorporate your voice on some of our committees. So um, I'll stop there. I know we've got a lot of agenda ahead of us, and we want to hear from all of you. So please feel free to give feedback, questions. All is welcome. And thank you all for the time.
Awesome. Thanks, Emily. Yeah, just to echo that, you're doing a lot of this work already. And so we don't want to reinvent the wheel. And if there's something here that you're like, oh, we're definitely a part of goal 3, number 2, or objective number 2, then that's a great thing to let us know what you're doing and how we can partner on that to make, we would help elevate the work that you're already doing. But like Emily said, the board will be working on creating strategies, and we had a wonderful consultant who helped us come up with those metrics. That was not easy for some of these, but we came up with some great ways to measure the work that we're going to do, and that we're already doing as well. Emily, did you also want to do a drawing? Are you?
I have it all set up and I forgot. Yes, thank you so much for reminding me, Kara. So we had 86 people participate directly by responding to our survey or by participating in our focus group. We're super, super grateful to those folks. And so we did want to draw right now one of those names for a $50 Visa gift card. They don't have to be here. So we'll see if anyone happens to be here, but maybe you'll have heard of them. And I have it all set up in my Excel right now. So let me drum roll, please.
Oh,
Rand between, enter. All right, number 84. So that is going to be Amanda Ellis. Amanda Ellis. If you happen to be here, that would be incredible. But we'll reach out to Amanda and she'll receive a $50 gift card. But thank you all for your participation.
awesome. Thanks. Does anyone have any questions? Any thoughts that you want to share based on Emily's awesome and succinct presentation on our strategic plan? We'll be sharing it in our newsletter again soon and on social media so people can see what we're doing and you'll have more opportunities to share your thoughts. Thanks, Katie. All right. Well, I think we can move on to the next part of our agenda, which is hearing from all of you. This is a great time to have cameras on if possible, if our computers can handle the cameras all being on, so that we really feel like we're here together. And I think we'll start with Samantha, if you are available to give us an update on WIC.
Hi, yeah, I'm here. Thanks. Um, Hi, Jan. I just want to say hi. Um, so I'm Sam. I'm the nutrition coordinator at the Maine WIC State Agency. And so just some updates from the state. We are continuing to support our local agencies and their support with participants in human milk feeding and all WIC services. From a government standpoint, just to talk about funding, you all know that we are in a shutdown. But WIC has received a little leak of money. It's not enough to be fully funded, but we have enough money. We're good to serve our participants at full capacity, have all of our staff working at full capacity, and take new participants on. And we're good. We're looking through about mid-December, is where our funding is right now. Just because our funding is good through December doesn't mean that that we would stop services if anything, if we didn't receive more. We have some backup plans and some other ways that we can kind of pull back services while still providing lactation services would be one of the things that we would fully support. But we have a backup plan in the event that we don't get fully funded. I guess an ask from the state agency is we aren't allowed to talk to our legislators. We can't speak directly to them working for the state. So if any, if you could reach out and support of the WIC program and funding us fully instead of doing these little continuing resolutions and these little band-aids, that would be a super helpful ask of all of you. And I think that's all that I have, unless anybody has any questions. And hi, Lindsay. I'm seeing all these people I haven't seen in so long. But thank you for letting me update you on where we are with WIC.
Thanks, Sam. Does anyone have any questions for her about that? Thank you for doing everything you can to keep everything up and running despite the challenges. And yeah. All right. Lindsay, would you like to go next actually and give an update? I did share before you hopped on about your opening, but if you want to share more about who can donate, who can use the dispensary, any details that would be helpful for everyone to know and where you are.
Thanks for sharing. Yes, the news is supposed to do a story on it, but they keep canceling on us last minute. So we've all been very stressed, but getting the word out there, anything breastfeeding related is good. So we'll keep trying. Yeah, so we're open. I actually just got a 1,300 ounce donation for our first donation, which is really cool. From a mom whose baby was born at 26 weeks and just came home from the NICU. So we're actually at capacity, so I can't accept any donor milk right at this moment, but they're sending me some more boxes, so I should be able to get that shipped out next week, and then we'll be open again for receiving milk. And then anybody who's interested can contact us, and we can set up an appointment to receive donor milk. Right now, we're limiting it to 0 to 3 months. But if there's, any extenuating circumstances, it's kind of at our discretion to who we can dispense milk to. So just, of course, we all know that it's a limited resource. So just we're being mindful of that. But otherwise, we're up and running, and it's been really excited. So thank you.
Congratulations. I know there's a lot of time and work put into that. At the same time, do you have any advice for anyone who might be considering opening a depot or a dispensary? Can you share a little more about the process?
The process started before I even was here. So they started it, I believe it was pre-COVID. I think that being Maine Health, we might have had a little bit more that we had to go through because of like certain policies. But I think my advice would just be to start out by reaching out to the Mother's Milk Bank Northeast to talk about the steps to get started, because they have been incredible. They email us back like almost immediately whenever we have a question. They've been super supportive, and they really walked us through the whole process. Besides the paperwork piece of it, we really just needed the freezer. We did need to hook it up into our alarm system so that if the freezer fails, an alarm goes off. So some of the like logistical pieces of it, I wasn't super involved in. But yeah, I guess I'd say the first thing to do is just reach out, because they're awesome.
Awesome. Thanks. Does anyone have any questions for Lindsay? Okay. Who'd like to go next? Looking to see who's here.
Here, I can share briefly about Help Me Grow. So I'm Melinda from Help Me Grow Maine. If anyone isn't familiar, we are a free resource for anyone in Maine who's pregnant or parenting a child 8 and under. We help with getting families navigating systems and connected to resources that they need, as well as developmental screenings. A lot of the need in this past year, and certainly right now, is basic needs like getting families connected to food, clothing, diapers, those kinds of things. I wanted to mention with Sam's update about WIC that Help Me Grow, although it is a state program, it is completely funded by federal grants. And so we are being floated right now by the state. We have only been guaranteed that we will be floated as a program until 12/1. So if the shutdown continues after that, there is no backup plan that we know of for Help Me Grow to continue functioning during the shutdown. So we'll obviously keep everyone posted. We hope it doesn't come to that. Really, really hope. But we that is an update, and it's certainly not just us. There are 2,500 Maine state employees who are funded by federal funds. So all 2,500 of those people are potentially facing some big challenges either already or in the next few weeks. So there is that. That said, we are plugging away. We're working every day until they tell us not to. So serving lots of families, and demand for car seats has been really high. We worked with some grant funding to arrange a training this fall for 22 new child passenger safety technicians from all over the state, because there is so much need and so much interest, which is great. So that training is happening this month. So that will be great to build up the ranks of who we can connect folks to for child passenger safety. The other thing I just wanted to quickly mention, Kara, can you make it so I can share a visual, please?
Sure.
If that's okay.
Yeah, just give me a second. Great.
Oh, great. Okay. I just wanted to quickly share something that is kind of our focus that we're going to be working on for at least late 2025 and into 2026. So we have been working with data from the Child Opportunity Index, which works with the factors that you see on your screen to give every town a rating. How much opportunity does a child living in this town have based on these factors or access to these factors? So the Child Opportunity Index map of Maine looks like this. So the darker the color, the more opportunity or access to resources a family has. The lighter the color, obviously the opposite, and then the gray areas are essentially uninhabited. And so Help Me Grow was fortunate to have our evaluator from USM overlay that child opportunity map with our Help Me Grow data to show us, of those low opportunity towns, which ones is Help Me Grow also not serving very many children in. And so it generated this this data set for us. So these are some particular towns that we are going to be trying to focus some outreach on coming up. And we've had some other partners who are interested in this sort of data, or kind of seeing like, hey, for what I do, what does the Child Opportunity Index look like? So I just wanted to bring up that that's a cool data thing that is out there. If you are someone who is curious about, like, I wonder in the county I serve what opportunity looks like, or where I could be focusing more of my energy, that might be useful for you as well. So I wanted to put that up there.
That's really interesting, Melinda. Thanks for sharing that. Could you put your contact info in the chat for folks if they want to reach out?
Yeah, absolutely.
Thanks. All right. Katie Reed, would you like to go give some paid leave updates or any other Mainland Women's Lobby updates?
Yeah, sure. Thank you, Kara. My name's Katie. I use she, her pronouns. I work at the Maine Women's Lobby, and we convene the Paid Leave Coalition, which we've worked really closely with you all in the Breastfeeding Coalition on that work. So I'm happy to give a short update on where paid leave is right now. So as many of you know, Maine has passed a comprehensive paid family and medical leave program, which means people can take workers in the state who are part of that program or in an equivalent private plan will be able to take time off of work to care for themselves, a family member, or for safe leave, and that will be at some a pay rate. So they will no longer have to do that unpaid. The timeline for that, where we're at right now, so the bill passed in 2023, and since then there has been a lot of work to build up that program because it is a brand new program in Maine. And so where we are right now, the rules have and regulations have been finalized. There is currently a actuarial study, so contributions have started. So you may have noticed money coming out of your paycheck going into this plan. It is like a social insurance program. So we are all funding it. And then when we need to take time off, the state will be able to support us in doing that. And we can take some of that time, up to 12 weeks of time. And so that has started, and now we are in a place where there is a study happening to see how much funding is coming through, what it could look like, looking ahead at how many people may be taking this benefit initially, and making sure that the program is solvent and people can take that leave. So that is happening now and will be released in December and January for the oversight group, which is called the Authority, to review. And then they'll be able to sign off on whether the benefits can start in May of 2026 or not. So that is the current timeline. We're hoping that everything goes well, and we are hopeful that May of next year, people will be able to apply and take time off of work with some of the supplemental funding. It can, for folks who are lower wage workers, it will replace about 90% of their income. And then as you slowly get a little bit over that lowest wage range, they have a tier level where you'll still get a pretty high return rate for your based on your pay. So that's a little bit about like where we're at with that. In the meantime, our Paid Leave Coalition is working on providing education so people know that this is available to them and is coming. And the Department of Labor is also going to be rolling out a comprehensive marketing and education plan. So I'm happy to answer any questions around that if people have them.
Thank you, Katie. Any questions for Katie?
I have a question. Is there, just speaking about education, what occurred to me is like, wow, someone who's at work pregnant may not be informed by their employer that this is even an opportunity. Has there been discussion that that's like required?
Yes, to a degree. So all employers are required to have like any other labor law, they're required to have posting about this, about people's rights in there. And so the Department of Labor, if you go to their website, so it's maine.gov/paid leave, all one word. They do have employer resources where you can download that the labor posters that they have. So they do have them in multiple languages too, which they are asking folks to use. So that is the extent of it. They do need to have that, and then also tell their employee that there is that information about it. So they are required to offer that. It's also outlined in the law that employees be notified that it is an option. That doesn't mean that's comprehensive education though. So our plan is to try to do more thorough education with folks. 'Cause
Requirement is a nice word, but who knows how far it'll go.
Yeah, so we know there's a lot more to do around educating the public on this, but there is that baseline requirement.
Yeah, and that's one reason why we bring this up so often in our meetings and in our newsletter and social media when we can, is to make sure that you all know how you can best educate the families you're working with if you're working directly with families. And you know who your resources are. Like, you know, you could go to Katie with any questions that you have or any questions that your families that you're working with might have. One thing I didn't mention in our update is that we have received some funding from Maine Mom, the maternal opioid misuse program, to develop a substance exposed infant substance use disorder and breastfeeding toolkit for providers. I think I may have mentioned this at the conference. And Pasika is here, and I believe she introduced herself in the chat as well, but Pasika has been doing a lot of the work on this, developing the content. We've put it out recently for review, but I'm among a few folks. We'll have it designed, and we'll also be doing a sample policy for folks. But I wanted Pasika to have a moment to share a little bit about what she's been doing and the project in general.
Hi, I'm Pasika. I'm a pediatrician with a background in newborn medicine. I'm not clinically practicing, but I did start breastfeeding and lactation medicine training this spring and kind of stumbled upon the coalition and have been very happy to collaborate and to work on the toolkit specifically, as Kara said. It's in collaboration with Maine Mom. It's going to be primarily a toolkit for Maine providers, basically aligning a decision tree with the Academy of Breastfeeding Medicine protocol for lactation and substance use, and just basically delineating what's safe, what isn't safe, kind of walking through the different scenarios where there might be decisions that need to be made, and also focusing on maintaining respectful communication and trauma-informed care, and as well as really bringing in the birth parent as the primary decision maker. And then alongside the toolkit, we'll be doing a kind of a landscape review, so we're aware of what gaps there are, what the current policies are in place throughout the different institutions in Maine, and we'll be providing them with a sample policy to kind of help guide decisions on a hospital level. And also there will be a parental handout, so that'll kind of give some hopefully more education information to the parents so that they don't have that accessible. And I think yeah.
So working with Dr. Elaine O'Connor, who many of you may know or have heard speak before on the topic of perinatal substance use, and working with the Office of Child and Family Services. They're looking to us for some guidance on this. So I'm curious, since we have some time here, and I know we have some folks who might have some other updates as well, I hope, but curious if there is anything that you think we should know, or any examples, any such scenarios that you've run into where you feel like this would have been a really helpful toolkit to have when I was working with this family, or this is what I really wish providers, pediatric providers, OCFS, really wish that they knew when supporting this family, this mother and this baby. What would you like us to know, or what would you like us to make sure we have included in this toolkit? And what would you like us to include in the patient education handout as well? Jan, I see your actual hand up. You're on mute.
Yes, I had great opportunity
to our 1-hour course called
wait a minute.
Sharing Babies' Behavior.
So you're on mute still.
Sorry, I hit the wrong button. Yes, well, I've just recently had the opportunity to work with a woman in New York City who has a physician there who's been working for years with pregnant ladies with substance abuse issues. And so we're collaborating on using my digital parent resource page that I shared at the conference, which is a one digital page that has a video about understanding newborn behavior, and then has this graphic that looks at development from birth to 1 year, and a little 2-minute video about that. And she was really excited about this because the idea of integrating child development literature with lactation support literature. And I'd be happy to share that, create a page that would work for what you're working on. We could talk about that if that'd be interesting to you.
Thanks, Jan. Yeah, I'm a huge believer in having that infant development education go alongside with lactation education, and really enjoyed your talk at the conference and the resources that you've developed. Uh, So I'm happy to see what you're referring to, and we'll consider that. I think one of the bigger challenges we have with this is keeping it all concise. It's a really tough topic in general. There's a lot of nuance, as you probably all know. And we were charged with creating a toolkit that was 3 to 5 pages long. And we're going to do the best that we can. We have a lot of really good content that we think would be helpful, but we also want it to be something that's usable, that providers will actually use, which is where we're excited about the design process too. The same designer that helped with our workplace toolkits will be helping to design and help co-brand the toolkit. So, Emily, thank you so much for being here and leading our board as the board president. So thank you for sharing that, Jan. Yeah, we'll definitely consider it. Send me what you can. We'll take a look at that. And Gina, also, I see that you are now in Maine. I don't know how long you've been in Maine. How long have you been here now? I know you were talking about moving here. Oh, you're on mute. I can.
Okay, get to the right screen. Hi, I'm here. We moved in September, so we're in Lisbon, just south of Lewiston, and yeah, I'm in private practice and I do home visits as a lactation consultant, and I'm a midwife.
Awesome. Welcome. And
Thank
are
you.
you listed on our Zip Milk directory yet?
I think so. Yeah, I submitted for it, so
Okay, great.
but we have a dog appointment at 1, so I have to get going.
Great.
Nice to see all these faces, and I'm excited to meet you guys. If you need any help with anything, just feel free to get in touch with me.
What's the best way for folks to get in touch with you?
I can put it in the chat, just an email or a phone call.
Great, thank you. Any other thoughts on the substance use topic? What kind of experiences have you had where you feel like you could use some more guidance?
I guess one question I had just about the process is if there's people who are in recovery themselves who are going to be providing feedback on the draft, especially around the communication piece, just so that there's people who are in recovery who have eyes on how things are being communicated to them.
Absolutely. I did send the draft out to Kate Vaughn today, who I know has connections. Thank you for that recommendation, Sarah. And Elaine has said that she has some folks who she could connect with, but that's a great reminder because I need to check in with her on that. So thank you. It's a really important point. And we have lots of drafts still to go for people to review, but the actual content itself, we want to have first look at. Any other thoughts on that? Okay. if you think of anything, you can always reach out. Let's see, who else has something you'd like to share? I'll start calling on folks if you aren't raising your hand. Sarah, do you have any updates from the Maine Doula Coalition?
So Kate Vaughn and I are doula implementation consultants on the Transforming Maternal Healthcare grant for doula coverage under Maine Care. So we are, the grant requires that we form a Maine Care Doula Council to help inform the doula benefits. So we are in the process of convening that council, and I think we'll be having a first meeting by the end of the year. So that's exciting. And then we've also convened outside of Office of Maine Care a second group of doulas and some public health professionals who are going to be helping to inform that support council and also run a public education campaign about doula services for Maine Care recipients and also for healthcare providers to let everybody know about what doulas are and when the benefit is coming and things like that. So there will be some points along the way as we go through the rate determination process with Office of Maine Care and seek funding from the legislature over the next few years, where we'll be looking for people to provide some support and testimony and advocacy around that benefit. So just to kind of let everybody know what we're up to, and also just give a heads up over the next couple of years that we may be asking for support and input as we get that benefit rolled out.
Awesome. Thank you for doing that work and bringing doulas to folks' attention, the amazing resources that you have. I know we have some folks from Maine Families here and Maine Children's Trust. We have some public health nurses here. Any updates you'd like to share? Any questions you have for the group? Anyone?
I'm glad to just introduce myself. My name is Molly. I am with the Maine Children's Trust. I've been in my role for just the last month, but I am the Maine Family Systems Coordinator, so providing some statewide level support for the folks, some of whom are on this call, that do that work locally. So glad to be here and meet everyone. I will put my information in the chat.
Awesome. Thank you, Molly. I noticed your new face to me and saw your introduction, so I'm really glad you're here. Who was in your role before?
Kobe was in my role before, Kobe Chase, but at these meetings, I think also Ivory Mills, who's our training and technical assistance coordinator, has also been part of these.
And she's still in her role.
Yes, she is. She's just not here this week. Yeah.
Okay. Great. Excellent.
I had one more thing to share.
Go ahead.
Well, I was really so inspired by my meeting with all of you in September that I did end up talking to a lot of WIC programs and some other breastfeeding coalitions around the country, and it just was heartbreaking to hear how they're just really having to lay off breastfeeding peer counselors, all around the country. And so I created a 1 hour Zoom presentation of basically the information I presented to y'all at the coalition, and I'm making that available free for any WIC programs and any statewide breastfeeding coalition. So I have about 15 breastfeeding coalitions now that are sharing it with their members. So I'm just going to put the link to that in the chat, and you all would be welcome to share it with non-lactation, non-IBCLC types, maybe your nurses at your hospitals or postpartum people or doulas or anybody else that might be interested in understanding baby's behavior. I'm just going to be spending a lot of time making that available around the country. And if any of you have any organizations, kind of nationwide organizations you work with, that you'd like me to make it available to them, I'd be happy to do that. It is approved for one CERP or one nursing contact hour credit.
Awesome. Thank you so much, Jan. Is that something you'll put in the chat box, or will you email that to me?
Well, yeah.
All right. Thank you so much. It's a lovely gift. Karina, I see your hands up.
Yeah, I'll introduce myself as well. I'm fairly new, but at least to this organization, I'm a La Leche League leader. I just completed that training a few months ago, and have been with La Leche League for at least 2 years now. And, although I don't have certifications currently, I aspire to maybe have one day. We'll see where this path takes me. But I come to this work as a very passionate mother of a child who is still breastfeeding. She'll be 3 next Friday, actually. And even before giving birth to my biological child, I was very enthralled with, um, big corporations selling formula, both in the United States and all over the world, as like a practice that just really turned me off. And I'm also really fascinated and interested in the stigma that's around breastfeeding, particularly in the United States for children that are, past a year. I experience a lot of that stigma, and I had this odd feeling that I would have to face that because my child was a big nurser. So I didn't have a hard time with latching, but we've had a hard time with weaning. So I, don't really have a lot of people like me who are around me in my immediate community. And so I bring all of those thoughts and experiences to this role. And I work in digital communication, so I look forward to being able to provide that skill to the organization too.
Awesome. Thanks for introducing yourself, Karina, and I'm so glad you're a part of the organization, and we're really excited to have you here. And you also shared that you might have some interest in furthering your lactation education and credentials, and that's something that we'll be putting out as well as a kind of a survey for people to share if they're interested in following along the IBCLC pathway. And if I can find the link, I'll drop it into the chat here. But we might be able to partner with Maine, with our moms. So not Maine Mom, but our moms, which is a rural maternity. I don't even remember what the rest of it stands for, but they might be able to help support some folks in their IBCLC pathways. And that is also part of our strategic plan, as we heard Emily share earlier, is helping to expand the workforce. So we want to at least get an idea of where people are in that, if people are on a pathway, if they're interested in getting on an IBCLC pathway, what the challenges are in doing that. We want to gather that feedback first so we can help target what our strategies are around that. So I'll see if I can take a moment to find that list or that link. And the other thing I was looking for is Breastfeed LA. That is another great organization for you to follow if you don't already. But they sent an email out recently where about the latest Bobby campaign, the Bobby formula. I don't know if anyone has seen that, but it's they have some real concerns around how that campaign is being launched. And so I'm put in the chat box right now a link to well, it's a joint statement to end Bobby's predatory campaign. I have not filled this out yet from the MSBC. I needed to look at it a little bit closer, but if that's something, and they're looking for organizational sign-on, so that's the link that I just sent. I'll see if there's another link that I could share, but anyways, you had mentioned the formula piece, and I will also see if I can track down the other link that I was referring to. I think I have it here, and I'll be putting it out in the newsletter and on social media as well. It is a Google link for those of you who might not be able to access Google. I apologize. And if you have any questions about the actual form, if you feel like there are some questions missing, that's really helpful feedback for me too. We have just a couple of minutes left. Who else has something they'd like to share? Any questions for the group?
Hi.
Julie?
Hi there. I'd just like to introduce myself. This is the first time I've attended one of your meetings. I'm a CLC. I'm also a certified labor and postpartum doula, integrative health coach. I have my own business. And I also work as a home visitor for Early Head Start for Midcoast Maine Community Action Program. So I was excited to see Wick here and some other community partners that we work alongside, and just really grateful to be here and hear all of this information and great resources to pass on to my clients. So thank you for inviting me.
Awesome. Thanks for being here. I appreciate it. Karina, I see your question about a YouTube link to the campaign. I don't have that easily accessible. The image that they shared in their email, which it didn't look like it was an email to their newsletter that they sent out. It was an email to other, I think, coalition directors. But that email included this ad here. You're not a bad mom for giving your baby formula. You know it's bad, not feeding your kid. And we know, I think everyone here understands there's a place for formula, right? A formula is not evil. It's not the worst thing in the world. Families sometimes need to use it. But the campaigns like this can really complicate feeding experiences and feeding goals. And we have to speak up about it. It's complicated. It's another complicated topic for sure, but it's messy. All right. Any other thoughts or questions before we wrap up?
Hey, I don't know if this, Shauna. Yeah, I don't know if you saw my comment. Jan, I'm not seeing when I click on the link that you posted, I don't see anywhere where that is free.
Does anyone else? Is it the video that's on there? Is Jan still here with us?
Yeah.
Oh, she's on mute. Okay. Here, what I'm gonna ask to unmute Jan, and it might give you a quick button to.
I'll send it again. Mhm.
Okay, thanks. Yeah, I was able to get to the page, to this page. I don't know if the link came through the same way for you or not, but okay, and then there's a blue here. I'll share my screen again. Purple, rather. Did I say blue? I'm seeing this bar. Is this where people should click on?
Yeah, you click on that, and then that gives you the steps to take the course and to get credit.
Okay.
Thank you.
Sure.
Okay.
But you made me realize I can just move that up. It'll be better.
Thank you so much, Jan. Thank you everyone for being here today and participating in our coalition meetings. It really makes a big difference for all of us in this network. And thank you so much for all the work that you're doing every day. We hope to see you at the December webinar or the January meeting. Have a good day.